Your knees are being destroyed right now. And the worst part is, everything you have been told to fix them is probably making them worse. The stretches, the rest, the ice packs, the anti-inflammatory pills. Science has quietly moved on from all of it, and nobody told you. What you're about to hear in the next 12 minutes has been quietly buried in orthopedic research journals, discussed in private physical therapy conferences, and almost never makes it to the people who need it most, people like you, who are tired of waking up every morning and feeling that familiar ache the second your feet hit the floor. So stay with me, because by the end of this, you are going to understand your knees in a completely different way. And that understanding alone is going to change what you do next. Here's the first thing nobody tells you. Knee pain is almost never actually about your knee. That grinding, that aching, that sharp stab when you go down the stairs, your knee is the victim, not the criminal. It is screaming because something else in your body is failing it. Your knee is the most mechanically unforgiving joint in the human body. It sits between two of the longest bones you have, the femur above and the tibia below, and it has almost no natural side-to-side stability on its own. It depends entirely on the muscles, tendons, and tissues around it to keep it aligned. So when those surrounding structures are weak, tight, or firing in the wrong sequence, every single step you take drives force into the joint at the wrong angle. And that cartilage, which has almost no blood supply and almost no ability to heal itself, slowly gets ground down like a pencil eraser on sandpaper. And the cruel irony is that the more pain you feel, the less you move. And the less you move, the weaker those supporting structures get. And the weaker they get, the more your knee suffers. It is a death spiral that most people never escape because they are only ever treating the symptom, not the source. Now here's something that will genuinely surprise you. One of the most consistent findings in recent orthopedic science is that the glutes, your backside muscles, are the single most important muscle group for knee health, and the vast majority of adults walking around today have glutes that are functionally switched off, not weak, switched off. Years of sitting in chairs has literally reprogrammed your nervous system to stop activating those muscles properly, and your knee is paying the price. When your glutes fail to fire correctly, your femur, the thigh bone, rotates inward when you walk, run, or squat. That inward rotation drives your kneecap out of its groove, pinches the fat pad beneath it, compresses the cartilage on the inner edge of the joint, and inflames every soft tissue structure that was never designed to absorb that kind of load. Researchers at Dalhousie University in Canada found that people with chronic knee pain had measurably lower glute activation during walking than people without knee pain. And when they corrected the glute activation, the knee pain resolved without any direct treatment to the knee itself. So, what do you do about it? You need to wake your glutes up before you do anything else, and not with the exercises you're probably thinking of. Traditional squats and lunges will not do it if your brain has already learned to compensate around the glutes. The most effective reactivation exercise is one almost nobody is doing. It's called the side-lying clamshell with a 2-second pause at full external rotation, and you need to do it slowly, deliberately, feeling the contraction at the top, holding it for a full 2 count, and then lowering with control. Not for reps, for sensation. 15 repetitions on each side every single morning before you stand up out of bed for 6 weeks straight. This is not a workout. This is neurological reprogramming. You are teaching your nervous system a new firing pattern, and it takes repetition and intentionality to override a pattern that has been building for years. But here's where it gets even more interesting and more counterintuitive. One of the most exciting findings in knee pain research over the last decade is about load. For most of recorded medical history, the standard advice for a painful knee was rest, take the load off, let it heal. And for acute injuries, a fall, a tear, a collision, that advice has its place. But for chronic knee pain, the kind that builds slowly over months and years, rest is one of the worst things you can do. This is because cartilage, unlike most other tissues, does not get its nutrients from blood.
It gets them from synovial fluid, the joint's natural lubricant, and synovial fluid only circulates inside the joint when you move it and load it. A knee that is rested is a knee that is slowly starving its own cartilage of the nutrients it needs to stay healthy. This is why people who have been resting their knees for months often feel worse, not better. The joint becomes stiff, the fluid becomes thick and lazy, the cartilage gets drier and more brittle, and every movement becomes more painful than it would have been if they had simply kept moving intelligently. The key word is intelligently, not ignoring pain, not grinding through it, but loading the joint with intention.
This is where a concept called mechanotherapy comes in, and it is transforming how the best sports medicine clinicians in the world are treating knee conditions. Mechanotherapy is the deliberate use of mechanical load, exercise, to stimulate tissue repair at the cellular level. When you load a tendon or a piece of cartilage correctly, you create a mechanical signal that the cells inside that tissue interpret as a repair instruction. They respond by producing collagen, by organizing their fibers, by literally rebuilding the tissue from the inside out. The dose has to be right. Too little and you get no signal. Too much and you create damage faster than the tissue can repair it. But when you get it right, you can rebuild tissue that medicine has historically told us was beyond recovery. And what does the correct dose look like for the knee? Slow, controlled, partial range of motion loading that keeps the joint in its pain-free zone while still challenging the surrounding musculature. One of the most powerful exercises in this category is the Spanish squat, a variation almost nobody in mainstream fitness is talking about. You attach a resistance band to a fixed point at roughly waist height, hold it in front of you, and lower yourself into a squat position with your shins perfectly vertical, not tilting forward, so that your knees travel minimally over your toes, and almost all the load falls into your quadriceps and glutes, rather than being driven into the joint itself. 5 sets of 8 to 10 repetitions with a 3-second descent and a 3-second ascent. Slow, controlled. The slowness is not optional. It is the mechanism. The slow, eccentric contraction is what creates the mechanical signal that triggers tissue repair. Now let us talk about diet, because this is where some of the most overlooked science lives. Chronic knee pain almost always exists inside a body that is inflamed. Inflammation is not just the redness and swelling you can see. It is a systemic biochemical environment that makes every pain signal louder, every tissue more sensitive, and every attempt to heal more difficult. And your diet is one of the most powerful levers you have for modifying that environment. Here is what the research actually shows, stripped of all the supplement industry noise. The single most impactful dietary change for joint inflammation is reducing your consumption of omega-6 fatty acids, specifically linoleic acid, found in high concentrations in seed oils. Canola oil, soybean oil, corn oil, sunflower oil, cottonseed oil. These are in almost every processed food, every restaurant meal, every packaged snack. They are not inherently poisonous, but when consumed in the quantities that have become standard in the modern Western diet, they dramatically shift your body's ratio of omega-6 to omega-3 fatty acids. And that shift has a direct, measurable, dose-dependent effect on the production of inflammatory signaling molecules called prostaglandins and leukotrienes, the same molecules that your anti-inflammatory pain pills are designed to block. Why take a drug to block those molecules when you can reduce the raw material your body uses to make them in the first place? The flip side of that equation is increasing your omega-3 fatty acid intake, not from supplements first, from food. Fatty fish, sardines, mackerel, wild salmon, anchovies. These contain EPA and DHA, the long-chain omega-3 fatty acids that directly compete with omega-6s at the cellular level and produce anti-inflammatory signaling molecules instead.
A study published in the journal Arthritis and Rheumatology found that patients with knee osteoarthritis who significantly increased their dietary omega-3 intake showed measurable reductions in joint effusion, swelling inside the joint, within 12 weeks, not years, 12 weeks, from food. The second dietary lever is collagen synthesis, and this is where things get genuinely fascinating. Your cartilage is primarily made of type 2 collagen, a specific protein structure that your body builds from amino acid precursors. One of the most important of these is glycine, and glycine is found in almost zero quantity in modern diets because it is concentrated almost exclusively in the connective tissue, skin, and bones of animals, the exact parts of the animal that modern food processing discards. Our great-grandparents got abundant glycine from bone broths, from slow-cooked cuts of meat, from eating the whole animal. We get almost none. Supplementing with 10 to 15 grams of gelatin or collagen peptides alongside vitamin C 30 to 60 minutes before your knee exercises creates a documented spike in collagen synthesis within the joint. The research on this was done at UC Davis and published in the American Journal of Clinical Nutrition. Your body is actually trying to repair your cartilage, and you need to give it the raw materials at the right time.
Now, let us talk about one more thing that almost nobody is addressing, and it might be the most important piece of the entire puzzle: your nervous system. Chronic pain that has lasted longer than 3 months, is no longer just a signal from damaged tissue. It has become a learned behavior of your nervous system. Your brain has essentially turned up the volume dial on that pain signal because it has become convinced that your knee is a dangerous, fragile thing that needs constant protection. This is called central sensitization, and it explains something that many people with knee pain find deeply confusing: why the pain seems to have no relationship to how much activity they do, why it can be worse some days for no apparent reason, why it sometimes hurts even when imaging shows no significant damage. Your brain is generating the pain independently of what is actually happening in the joint. And this is not in your head in a dismissive way. It is in your brain in a very literal neurological way. The treatment for central sensitization is education, graded exposure, and the gradual rebuilding of confidence in movement. Every time you move your knee through its pain-free range and survive without disaster, you provide your nervous system with new data. You are telling it, slowly, repeatedly, through lived experience, that this joint is not as fragile as it thinks it is, that the volume dial can come down, that movement is safe. This is why the psychological aspect of recovery is not soft science or motivational fluff. It is hard biology. The studies are unambiguous. People who understand their pain, who have been given accurate information about what is actually happening inside their body, recover faster and more completely than people who have been given vague diagnoses and frightening imaging reports with words like bone on bone and severe degeneration printed on them. Words matter. Understanding matters. And what you now know about glute activation, about mechanotherapy, about inflammation and nutrition, about the nervous system is real medicine. It is the kind of medicine that puts you back in the driver's seat of your own recovery. So here is the roadmap. Start every morning with clamshells before your feet hit the floor. Audit your cooking oils and eliminate the seed oils from your kitchen. Add fatty fish to your meals 3 times a week. Take 10 grams of collagen with some citrus 30 minutes before your knee exercises. Learn the Spanish squat and do it slowly and deliberately 4 days a week. And walk every day. Not to exhaustion, not to the point of pain, but enough to circulate synovial fluid, to tell your nervous system that your knees are alive and capable and not to be feared. Start with 10 minutes. Build to 30. That is enough.
You do not need to run marathons. You need to move consistently, load intelligently, eat to reduce inflammation, and give your nervous system evidence that healing is happening. Your knees have been asking you for something for a long time. Not rest, not painkillers, not surgery. Though sometimes surgery is the right answer, that decision deserves to come after you have genuinely tried everything else first. What your knees have been asking for is understanding. Now you have it. Use it.